6 health problems that cause back pain. Do you have constant back pain? There are people who experience this problem on such a regular basis that they view it as normal. It's not normal, however, and you shouldn't get used to it. Your back contains the largest support system in your body, the spine. If you don't take proper care of your health, you could wind up with this problem. Among the things that can cause back pain are lifting too much weight without proper precautions, and more serious problems. We'll talk about what some of those are today. Keep reading today's article and find out how your back pain could be warning you that you have a more serious condition. Pay attention and act accordingly to prevent your health from being affected. 1. Intervertebral disc. Over time and thanks to your posture and movements, these discs become thinner. This disorder is common among the elderly. However, it can also appear in younger women who have received an epidural during childbirth. If you detect this problem, it's important that you go see your doctor who can prescribe medication to cope with the pain. You could also use a back support to help keep your spine in place. In addition, massage is an excellent treatment and you should take a calcium supplement to keep this problem from worsening. 2. Lower back pain. Lower back pain can be felt from your ribcage to your buttocks. It's a condition that any person might experience during their lifetime. Because it's such a common problem, many people think that it has no real cause. This is not true, however. In most cases, several tests might be required, but there's always a reason. If you only experience it on occasion, pay attention to the activities you've been doing. It's possible that you have bad posture when you sit at your desk or that your job is causing this pain. Ideally, you should go to your doctor to rule out a more serious problem. 3. Osteoporosis. This disease causes your bones to be fragile and prone to serious injuries, even with minimal impact. In most cases there are no clear symptoms, but back pain may occur. If you're over 40 and your diet isn't particularly rich in calcium, it's a good idea to visit your doctor on a regular basis to rule out this problem. You should also see a doctor if you notice that your back pain occurs in the middle of your spine and you hear a clicking sound when you move. This is not normal at any time. 4. Fibromyalgia. Fibromyalgia is a chronic disease. Long-term pain is one of its most distinguishing features. This means that you might not only have back pain, but joint and muscle pain as well. The following symptoms are very commonly associated with fibromyalgia: sleep disorders, fatigue or swelling sensation, stiffness, intestinal disorders, numbness in the joints, heartburn. If you experience this problem, your doctor may prescribe several medications to treat each ailment separately. Although fibromyalgia cannot be cured, there are options for controlling the pain, but you'll have to find out what works best for you. 5. Scoliosis. It's a deformity that can appear due to congenital or neuromuscular reasons or for no apparent reason at all. When scoliosis is in the advanced stages, it usually causes compression or cramping in the spine, which leads to pain. To reduce the pain derived from scoliosis, you must have medical treatment. This usually includes physiotherapy routines, wearing a brace, regular checkups to see if the problem has worsened. 6. Endometriosis. Endometriosis is one of the most common diseases in women. In this case, back pain is due to unusual cellular growths that appear in the endometrium. The pain is typically acute and appears more frequently during the period. Although over-the-counter painkillers are beneficial, it's best to see a gynecologist to obtain the correct treatment. General recommendations to deal with these problems: see a specialist to receive the appropriate treatment, based on what type of disorder you have. Practice yoga. It's the perfect way to relax your body and fight pain and inflammation.